The government has released plans for the UK Rare Disease Framework. This covers awareness, coordination of care and access to therapies. Now, the government's Rare Diseases Framework has laid out challenges faced by those living with rare conditions and how they should be addressed. To explain more, I'm joined now by the Genetic Alliance UK's Director of Policy, Nick Mead. Nick, thank you very much for joining us. Talk to me about the main priorities surrounding rare conditions.
Well, the priorities of our community match up really well with the UK Rare Diseases Framework. The 4 priorities you mentioned of diagnosis, awareness of rare conditions amongst healthcare professionals, coordination of care and access to therapies all match up with what we're looking for. We've chosen to focus raising awareness on diagnosis because that's such a crucial part of the rare disease journey for everyone living with a rare condition.
Well, Nick, you mentioned diagnosis there. The Genetic Alliance UK have been looking into what a good diagnosis is. What are the key findings?
First of all, the framework wants to focus on an accurate and rapid diagnosis, and that's crucially important. We don't want to get away from that. But we also want to look at the experience of a diagnosis. This isn't something like a quick blood test at the GPs that can happen really quickly. Some diagnostic journeys take years. And so we need to think about the experience of people having that diagnosis and going through that diagnostic journey. So our recommendations include a central source of information for healthcare professionals to be able to supply information at the point of diagnosis, but also a plan for the diagnostic journey so that while a patient's going through that process, they know what care they can access, and they'll have that care coordinated for them. And finally, we want to produce a charter of the rights that patients can have around their diagnosis.
I mean, it's not just about the awareness, as you pointed out there. It's actually about that patient's journey and putting the patient at the heart of all of this.
Absolutely. We have to remember that as it takes so long, your life is carrying on around this, and people have relatives. 70% of rare conditions are genetic, so the rest of your family could be thinking about what's going on with your diagnosis. We could be thinking about whether we want to have more children or not, and the diagnosis might reflect on that. And then, crucially, there's treatment. And if we can't get a quick diagnosis for some conditions, then we miss out on the opportunity of treatment. So for every rare condition, there's a different story about why that diagnosis is so important.
And Nick, are more and more rare diseases being discovered all the time?
Yes. So in the UK, we're leading the world in genomic diagnoses. And while we use that as a diagnostic tool to find the conditions we already know about, we're also using the tool to understand conditions that previously haven't been recognised by medicine. And that means some of the families that have been stuck in a diagnostic odyssey for 8, 10, 15 years or so are finally getting the genetic code for what's caused their problem. So for us, it's crucially important that journey doesn't end with a bunch of letters or code in the post. It needs to continue with research, with information, so that they can get all the things that most of us would expect you get with a diagnosis, including a prognosis and information about the future.
And so genetic sequencing plays kind of like a crucial key role here, doesn't it?
Yeah, that's the main tool we'll be using to make those diagnoses, but also understand how the genome's working and understand where some of the less understood rare conditions are having their effects. We're also looking in the UK now at using genome sequencing as a newborn screening tool, which could have a lot of power to rapidly increase diagnoses at birth as well.
I mean, at this time in the world, we've got very limited resources, haven't we? It's quite important to make sure that, rare diseases, that things like this aren't overlooked.
Yeah, and I think over the past 2 years or so, the experience of someone living with a rare condition might be better understood. I think after the pandemic, the public will have a better understanding of what it's like to live with a condition that you don't understand, you don't know what the future holds, and a condition can affect your life in ways that you hadn't previously understood. So as the NHS faces a lot of pressures around recovering from COVID, we really want to see rare diseases included in that recovery plan.
Okay, Nick, thank you very much for your time today.
Thanks for having me.